Hi everyone, my name is David Robina. This is Ronan Patel, Aaron Kumar, and Finley Ursul. This is how do we prevent the spread of future pandemics? According to the Merriam-Webster Dictionary, a pandemic is, quote, an outbreak of a disease that occurs over a wide geographic area, such as multiple countries or continents, and typically affects a significant proportion of the population, end quote. In the past century, two pandemics have loomed more deadly than all others. The influenza pandemic of 1918, commonly called Spanish flu, and the COVID-19 pandemic. According to the CDC, there is no universal consensus regarding the origins of the Spanish flu. However, it was first identified in military personnel in the spring of 1918 and spread globally throughout 1919. In total, the Spanish flu killed 50 million people worldwide, 675,000 of those deaths coming in the US. Likewise, the COVID-19 pandemic was first discovered in Wuhan, China in December 2019, and has killed over 6 million people worldwide, 965,000 people in the US. These two viruses spawned similar responses from the American public, especially the increase of usage of NPIs, or non-pharmaceutical interventions. Common NPIs include the wearing of masks and the practices of self-quarantining and social distancing. Like COVID-19, NPIs weren't received particularly well with the American public during the Spanish flu. According to Robert Unwin, PhD, an emeritus professor at the University College London Medicine Division, quote, as with COVID-19, many people opposed wearing masks, and protest meetings were held that only served to spread the infection, end quote. In regards to vaccinations, Dr. Anthony S. Fauci, Chief Medical Advisor of the President of the United States, and others collectively state that, quote, inactivated bacterial vaccines intended to prevent death from influenza-associated secondary bacterial pneumonia, which caused the vast majority of pandemic deaths, were often used in 1918 and seem to have been moderately effective in preventing pandemic death, end quote. As you know, COVID-19 and Spanish flu have killed millions of Americans. Using the information gathered in the aftermath of each, and understanding that Americans need to accept practices in order for them to be beneficial, I ask you, what is the best way to mitigate the effects of a future pandemic?
So with this history and problem considered, what steps can we take to prevent pandemics in the future? Our first solution are vaccine mandates. Vaccines have been proven effective throughout different viruses, for example, the flu, measles, and most recently, COVID-19. According to the CDC, vaccines work with your body's natural defenses to help you safely develop immunity to disease. This lowers your chances of getting certain diseases and suffering from their complications. Also, according to the United Kingdom NHS, vaccines prevent up to 3 million deaths worldwide every year. This first graph is a study published in the New England Journal of Medicine who tested the efficacy of the Pfizer COVID-19 vaccine. The orange line shows the people infected with COVID-19 after receiving the Pfizer vaccine, and the blue line shows people infected with COVID-19 after receiving the placebo. Over time, people that received the placebo instead of the vaccine got infected with COVID-19. As shown in the upper left-hand corner, around 11 days after receiving the vaccine, the results started to show, and the vaccine started to be effective in combating the virus. According to the CDC, the Pfizer vaccine has a proven 95% efficacy in those aged 16 and older, and has proven over a 90% efficacy rate in those aged 5 to 15 years old. This next graph shows another study conducted by Xiao Chen and Hanwei Huang of the University of Hong Kong. The red line shows the amount of people infected with COVID-19, while the solid blue line shows people that have received one dose of the COVID vaccine, and the dotted blue line shows people that have received 2 or more doses of the COVID-19 vaccine. As you can see, overall COVID cases decreased as more people got 1 dose of the vaccine, and even less cases were reported after the 2nd or 3rd doses of the vaccine. According to the CDC, in addition to data from clinical trials, evidence from real-world vaccine effectiveness, studies show that COVID-19 vaccines help protect against COVID-19 infections with or without symptoms. So what are some drawbacks to vaccination mandates? Well, first, people want the freedom to choose to get vaccinated or not. According to a study conducted by Health Affairs, those opposed to vaccination mandates have argued that they are unethical because they might infringe on personal liberties or religious freedoms. As a solution to this, President Biden created the Vaccine or Test Bill, allowing people to get tested instead of vaccinated. However, this bill was still not agreed upon amongst Republicans and Democrats and was rejected in the Supreme Court. Finally, fear. People are scared of the COVID-19 vaccine because of how quickly it was developed, and chances are that they will still be scared in the future.
Our second solution is to implement quarantine. However, first we must define quarantine. According to the Centers for Disease Control and Prevention, also known as the CDC, quote, quarantine separates and restricts the movement of people who are exposed to a contagious disease to see if they become sick. In simple, quarantining is the process of staying at home to see if you contract the virus. Because we are slowly recovering from the coronavirus pandemic ourselves, we can look at how effective quarantining was for us in the past. According to Barbara Stray et al., the efficiency of quarantining showed to reduce the chance of receiving COVID by the range of 44 to 96%, and also reducing the chance of death to the range of 31 to 76%. However, Stritt says that alongside quarantining, implementing both travel and school closures showed to be the best mitigation for future pandemics. Another question that might be proposed is, how does one implement quarantine into the United States? At the state level, quarantine and other mandates are authorized by the governor or state board of health, according to Bloomberg Law. At the federal level, however, the U.S. Secretary of Health and Human Services is authorized to take measures to prevent the entry and spread of diseases from foreign countries into the United States. However, the authority for carrying out these functions on a daily basis have been given to the Centers for Disease Control and Prevention. With every solution comes its drawbacks. For quarantine, its first drawback is that it poses issues on mental health. According to Bill Javed, quote, quarantine and self-isolation can most likely cause a negative impact on one's mental health, end quote. Also, according to the U.S. Census Bureau, a third of Americans showed signs of clinical depression during the peak of the coronavirus pandemic. This means that almost 110 million people showed signs of depression because of having to stay at home and quarantining. The second drawback to quarantine is the loss of jobs and business closures. According to the U.S. Bureau of Labor Statistics, quote, of the 16.9 million people unemployed during the pandemic, 9.6 million couldn't go back to work because their employer closed or ran out of business, end quote. The reason for these business closures is primarily due to the fact that people had to stay at home, and with people not being able to support local businesses, they eventually ran out.
There is still one question that needs to be answered. What is the best solution? First, vaccination mandates. The pros of this solution would be that they would decrease harm and deaths due to the virus, as it was seen in previously shown graphs. Many vaccines are arguably the closest things we have to complete immunity. Also, they decrease hospital workload and stress on our essential healthcare workers. Although they have their downsides, vaccines have political implications that battle things like abortion. And if people are willing to take time out of their day and stand on street corners advocating for what they believe in, it is clearly important to them and they believe it should be important to you. The vaccine is also very expensive. According to CBS, $250 million was spent on marketing alone. The second option was quarantine. A big bonus of this was time. It slows the infection rate and provides valuable time for vaccine discovery and production. In addition, it's extremely cost effective as no money is involved with people just staying home. However, some negatives of quarantine are the revenue loss for exclusively in-person businesses like restaurants and attractions like amusement parks. There are also mental health issues that branch from quarantine. According to the National Institute of Health, kids are especially susceptible to anxiety, distress, and social isolation when put into quarantine away from their friends. Through all these points, we believe that vaccination mandates are the best solution, as the negatives that are seen with quarantining is too much to not neglect. Thank you.
Thanks, guys. Okay, I've got a few questions for you. Again, I'm going to number you guys student 1, 2, 3, and 4. So student 1, let's start with you. What's a way in which your team's resolution, that is your final solution there, makes you think differently about your personal research on your IRR? How did your thinking change?
So as you know, our resolution was that vaccinations are the better option, which is surprising to me because I'm a historical lens. The Spanish flu, which was what I researched, typically used NPIs to prevent the spread of COVID or to prevent the spread of the infection because scientific advancements weren't as advanced at that point. So I thought, well, NPIs are much safer, much more effective. Now, after reading Ronan's paper and seeing the presentation put together, I realized actually vaccinations are the better solution because there are less drawbacks.
Terrific. Okay, student 2. How did your group decide to include student 3's perspective into the overall presentation? Like, what part did student 3's individual IRR form of what you guys just presented here?
Okay, so Aaron used the economic lens, and when although we didn't use his economic lens as a solution, We used it when we were considering our different solutions to implement. So for example, solution one with vaccines that I wrote about, we talked about how the economic drawbacks of that because of how expensive it is right now for the government to buy and distribute vaccines. And also for our solution two, which was quarantine, it provided it imposed so many economic drawbacks to businesses due to all the business closures that people would have to endure. And so that's what helped us weigh our solutions and come to the conclusion that vaccines were a better solution overall.
Terrific. Student 3, describe an argument from one of your peers' reports that you guys didn't include as any part of this presentation we saw, and sort of why didn't it make it in?
Okay, so one of David's arguments was talking about how people during the Spanish flu, they used masks and they didn't have the technology for vaccines, so they had to use masks. And in our presentation, we didn't talk about masks being a solution because we simply thought that quarantine and vaccination mandates are more able to be implemented rather than telling everybody to wear their masks. And we thought that solution one and solution two are a better overall solution than implementing masks.
Okay, good. And then finally, student 4, give one specific way your thinking changed as a result of student 3's perspective. So how did it make you think differently about your work based on what student 3 wrote?
Okay, so my lens was political and his was working from home with the quarantine being very present in his work. So with mine, political, obviously, I thought a lot about how the Republicans versus Democrats look at things and the clash between those two sides. So he would be thinking a lot about how it was accepted into this work from home environment and how it would have affected the economy, as people are way less efficient when they're at home versus when they're in actual work.
Okay. Terrific. Nice job, guys. You are all done.